to stand because I woke up at 5 in the morning and all the time I have been sitting and I'm final speaker for the day, so I hope you are not too tired and you can enjoy. So I'm a Tiik person and I'm creator. And the rest of you, my background, you see in the slide. I'm a medical doctor, but I have involved in very much in technology. And I'm coming from Estonia, and I was responsible of implementation of national health information system in Estonia several years ago. It's up and running since 2009, and after that I switched to Finland as an advisor in Finnish Innovation Fund. And I want to mention that the Finnish Innovation Fund is not a fund who gives money for the project. Yes, we have some pilots and we support, but we are doing a lot of other things. We make a concept, we make white papers, and a lot of lobby work. So we're talking about sickness and patient and healthcare, but we have to also understand that health is not only the care. It is a very small amount of our health is what we can do in the healthcare, or may I say in sick care. There is a lot of other determinants which influence our well-being. It's environmental factors, our social behavior, our genetics, and of course ourselves, how we behave and how we use our resources, how we use our body. If you look the one concept what we have built in recent years together in Sitra, this is an example of what we can do with data. If you imagine 1,000 adults in 1 month, around 800 of them have some health-related concerns or problems. Today's environment, 329 of them are entering to the healthcare system, and they will be as a patients. But 406 are surviving and finding themselves solution. What was the problem in these cases? How did they solve this problem? Did they Google? Did they went to the neighborhood or some witches? We don't know, because we don't collect this data. We don't care. As a professionals, we haven't thought that maybe there is some clues for us which will solve our problem. Not the symptom, but the problem. Now, if you think that all these big data, open data, all these interactions are there, and also very important security. Security is not just that you authenticate the persons and systems in a strong manner, but it's also usability, accessibility, availability, and integrity of the service. And this kind of new digital services, I assume that already these design process have taken into account all these different dimensions of modern services. So if we have in place this kind of virtual clinic, what is this about? First, you think that you have some, you wake up in the morning and you have some pain or some just bad mood or whatever, and you try to find some reason for that. Maybe it is wiser to start some searching process, not just to call to the doctor in the first point. So the virtual clinic gives you offers you service where you can upload your problems, but you also give the consent to retrieve the data from the existing data sources. It could be your medical record, your personal health record, it could be some environmental tracking, it could be some mobile device, and you are owner of the data. You give the consent to the service, and you make like a virtual health check on this data. After the health check, you can use different analytics, big data, like mentioned Watson or decision support system, and then you enter to the two different systems. First is the existing healthcare system, and you have already narrowed the problem and maybe narrowed the services what you need, and you can maybe in the future go directly to this service what you most need. The other option is you get some guidance, coaching, even literature to read just and explanation. What is the reason of this symptom or complaint? So looking at this different data and how this data is collected, of course, medical professionals collect the data to the electronic medical record, and probably you collect your data to the personal health record, and if you can access to the data, you can use these new virtual services. So there is some evidences that if we use this kind of triage before you make your own decision, the need for real medical service is about 20% of these 800 cases. It is 160. In today's system, it was 329. You can split this demand to the half, and these persons who really need can access to the quicker and more precise service. So, as I mentioned, there is a different opportunities. You can use the mobile interface or laptop or whatever, and you can access to the different services. You can build a marketplace for service providers. You can have different formats of risk analysis and lifestyle coaching, for example. And of course, you can refer this data forward to another services as well, because you are in the wheel of the data. It's your data. Now, one slide about how many persons are willing to take care of some aspects of the health. And this is a study made in US, and there is also monetary value about how much it costs today to the healthcare system. And if you take some looks of it, it's, for example, you can measure the vital signs, and 54% of people saying that yes, they are ready to do that. And there is a lot of devices available and different analytical service to give you feedback. We have been in, for example, in Oulu, the project of odometry, where you give the device to the families, and they measure the ear infection or the movement and you can detect is there fluid or not. So the existing systems, but they are all separate, and the virtual clinic can connect them. Of course, the potential of analytics, we just entering to the world where we are not just collecting the health-related data, but we also can analyze it and can make some knowledge on it, and probably feedback this back to the real persons and providers. So that's my story, and I hope it will be soon available for all over the world. We have had already some pilots. For example, different aspects of this virtual clinic. We have tested in Hämeenlinna in one city in Helsinki, in Finland, and some other aspects in other region. So we're still going on with this concept and piloting different aspects. Thank you.